the very beginning of this conversation, when you were comparing your 21-year-old stories, right?
Yeah, yeah,
I was
yeah.
pregnant with my second kid at 21. So,
Wow.
what did I do on my 21st birthday? Not a damn thing. I
Nothing.
wasn't at a bar, I wasn't doing anything. I was pregnant with my second kid,
Wow.
and so, yeah, like we all have these different stories and you don't know. And I
Yeah.
didn't have a college education. I had the opportunity. My parents gave me that option, but like I said, I hated school, did not want to be in school. I've been working since I was 15. That's my, path,
Hmm.
because I would not have been successful right away for college. So I just want to make sure that my dad ever hears this or something, that like I had the opportunity, but I chose not to take it. I
Yeah.
got married, had kids, that kind of stuff. And then later it made sense to
But
me.
sometimes we got to take those detours. I'm one of those
Yes.
big things. Sometimes people have to see what rock bottom looks like,
Yeah.
for them to realize this is not where I want to be, right?
Right.
So,
It definitely wasn't a rock bottom. I just want to be clear that, but it just was like, okay, like,
no, not for you in your case, but just in
right,
general. Some people, right?
right,
You don't have to wait for rock bottom to get help. You just have to care enough to start,
right,
right? I
right.
think you mentioned
Or
that
you
as
just
well.
have to experience things to decide, oh, well, this isn't really for me. Or
For me,
if I
yeah,
want to do this, I'm going to have to do these things to get there. And so
yeah,
for me, I was like, unless I'm going to be working paycheck to paycheck all the time,
yeah.
I'm going to have to do something different.
That's it. No, for
Yeah.
sure. You got to get sometimes uncomfortable to get comfortable.
Hmm.
What does that look like? You could take that however you want to. It could be getting out of a relationship, getting a new job, getting therapy, like whatever that may look like for some people. Sometimes you just got to get uncomfortable to get back comfortable. You're
Right.
not alone. There's so many people going through it, and there's so many resources out there that could really help. You talked about the nonprofits helping our vets to be able to get this help because there's so many of them that need the help, but ideally feel it's too expensive,
Right.
right? And you guys are working with this nonprofit. Can you tell us how you guys are working with these nonprofits?
Sure. I mean, the veteran groups, we have probably the most connections. There's a lot of people who
Mhm.
really are connected to it. And we're so thankful and grateful for, the opportunity to be able to partner with different people to make sure that anybody who wants treatment has access to it. And we do things like, you know, no cost no interest payments. And we've, done everything that we can. And like I said, we decrease the cost of the things that weren't insurance covered. But
Yeah.
that being said, it still costs something. Even if you have health insurance and you have co-pays and stuff, it it doesn't matter at
Yeah.
what levels, people still need help. So there are many nonprofits that help fund a few people here, there, and stuff. But the biggest one in Illinois right now is the 100 Club of Illinois. Any first responder, they'll give up to $2,000 towards any sort of our mental health treatments that we have and they just have to be an active first responder. So police, fire, EMS. There's a whole list of people that qualify in that first responder list. And so we search for these opportunities, but some of them come to us. They're like, oh, we heard you're doing this.
I love
And
that.
we have these people
Yeah.
that aren't, getting help elsewhere. And we've worked with some larger entities that are funding treatment for the special forces. So people like the Navy SEALs, the Green Berets.
Wow.
Unfortunately, the Veteran Administration doesn't have the manpower, staff, money, resources, or whatever it might be. They don't fund some of these treatments, even the stuff that's covered by traditional insurance, like the nasal ketamine, TMS. Is very difficult for them to get through the VA. So we've partnered so that we can be part of the community outreach that they have. But not everybody who has trauma is veterans, right? And so
Hmm.
we have another couple of nonprofits. The primary one is Erase PTSD Now. Anybody can apply there. And, so you may have to wait a little bit for funding to become available, but that you don't have to be a certain category, or a veteran or a first responder, because many people outside of
Yep.
those areas also need treatment too. So we work really hard. We have a person in our, staff that's their whole job, is partnering with things. And
Before I give you this last blind question, I
oh,
got one question. I think there's a myth out there that you can bust for us. A lot of people think that when we think about seeking therapy, if it's too cheap, it's not good, right? And there's
oh,
doctors
if
out
it's
there
too
that
cheap, if it's cheap, it's not good. Hmm.
correct. But then I
Okay.
spoke to other doctors that created their own practices where this is what they do and they make it affordable. So a $99 a month, you can see this doctor as many times, XYZ, right?
Right.
That doesn't mean it's not a good doctor. It just made it more affordable. What is your thoughts when people think, if you could just kind of talk to that, people that think, hey, if it's too cheap, is not good for me?
Or is it too good to be true? That's probably an easier answer.
Mm,
Like, because we get a lot of skepticism on that. Like, if this has worked so well, or if this, and I have to convince people too, even that to take funding. I'm like, no, really, there's no catch to it. The 100 Club is going to pay for this for you.
yeah,
And so the too cheap to be true, I think that, we always are kind of have this skepticism behind us, but there are a lot of really great community resources in the mental health space that are doing a good job.
yeah,
Are they underfunded and maybe you can't see people as often or it's harder to get in? Yes, that's true. But that doesn't mean that they're not good quality services. There's just not enough of them. And some really expensive providers that we work with aren't doing a great job. Some of the people that are
mm,
coming from the, VA or the Social Services Administration, like from free care to coming to us, their providers have been doing a great job and they're the ones that are linking them to us. So it's not about the cost range. I think that there's really great providers on all ends of the spectrum. I think that the hard thing is that we lose faith and trust that there's still options and that treatment can work and that it's exhausting to keep trying, right? Especially if you're dealing with
yeah,
mental health, concerns. You've tried 10 times, number 11 gets really hard. And especially if you say it's going to be free or you're going to have to do this, but it's 80% effective, people are like, yeah, that's not true. That's not
yeah,
accurate. And, you know, then they see another provider that's another person that's not doing great. Sometimes they have to try 12 times before they find the right person who really understands what's going on. And so it's really difficult in that way to continue to have faith when, particularly in mental health, like the big problem is that we don't believe and that we lose hope and we lose faith and we lose trust and as part of the disease process. And so that's where it gets really difficult, but there is help available on all ends and free help. Maybe it's not the best help you've ever had. It's still help. And they may be
yeah.
able to connect you to somebody else like us who has a, grant funded resource that can help them with something bigger because we get tons of referrals from agencies who are seeing people in really difficult situations.
Such a great conversation. We're almost at an hour here, believe it or not. I leave you with this last question. If you could go back to one delivery room and whisper something into your younger self's ear, what
Oh,
would you say about the journey ahead?
geez. Me whispering to myself.
Go back to that one delivery room when you were younger.
I
Just
just think
starting off
that
in your
what you're
career.
doing matters. Like it's really hard sometimes to keep that perspective because not every day is joyful and
Mm,
there's a lot of really hard days in between. And I think you alluded to it that we all get into this space for our own personal reasons, whether it's our own personal traumas, our own, like many people in healthcare in general have some stories to tell. Many people who've been in the military have stories to tell, right?
yeah,
And you don't do hard work like this if it doesn't mean something, right? Because it's not fun a lot of days. It's really rewarding, but that doesn't mean that it's fun or great all the time.
yeah.
So on the really hard days or the times where you think I don't think I can do this, is that you can and it's worth it in the long run.